A normal end-tidal CO2 measured by capnography is 35 to 45 millimeters of mercury, and a normal carbon dioxide level in the blood is the same, 35 to 45 millimeters of mercury. Under normal physiology, these two values are very closely related, but not identical. The end-tidal CO2 that you see on your monitor usually falls just a touch lower than what is actually going on in your patient's blood, about 2 to 5 millimeters of mercury lower. But still, these values are pretty close. That small difference exists because the air we exhale at the end of a breath contains a little bit of gas from dead space, areas of the lung that are ventilated but not perfused. Since no gas exchange happens there, that air is slightly diluted in CO2. As long as perfusion and ventilation are normal, this gradient stays narrow, tight, predictable, and physiologic. But when it starts to widen, like in shock, pulmonary embolism, or severe ventilation-perfusion mismatch, it's an early clue that something's wrong with either perfusion or gas exchange efficiency. That's what makes end-tidal CO2 so powerful. It doesn't just tell us about ventilation, it tells us how well the whole cardiorespiratory system is working together. Now let's take a look at what the waveform actually means. It is a visual representation of carbon dioxide concentration over time. Now right away, you are probably thinking that this looks a lot like a ventilator waveform, but it's not. A ventilator displays pressure or volume over time. Capnography, on the other hand, shows gas concentration, specifically the amount of carbon dioxide present at any given moment in the breathing cycle. Let's break it down. The waveform begins here at phase 1, this flat baseline. The gas being sampled here is dead space gas. It's air that's been in the conducting airways but hasn't actually participated in gas exchange. That's why there's essentially no CO2. It reads close to zero. As exhalation begins, we enter phase 2. This is the sharp upstroke where dead space gas mixes with gas from the alveoli. You're now starting to see CO2 levels rise rapidly. Then comes phase 3, the alveolar plateau. This portion represents gas coming purely from the alveoli, where gas exchange is happening. The CO2 levels off into a gentle slope, reflecting uniform alveolar emptying. The very peak of that plateau, sometimes labeled as point beta, marks the end-tidal CO2, the highest concentration of exhaled CO2 in that breath. This value most accurately reflects alveolar CO2 and is what we use for monitoring. Finally, as inspiration begins, fresh gas is drawn back in. The CO2 concentration drops straight back down to baseline and the cycle repeats. So remember, this isn't a measure of pressure or volume, it's a direct window into ventilation and gas exchange, captured one breath at a time. Thanks for watching. If you found this helpful, go ahead and like the video and subscribe to the channel so you don't miss the next one. And if you want the full masterclass, along with tons of other high-yield medical education, visit academy.emergeprep.org. And I'll see you in the next lesson.